So that's a real good question. I remember a patient that I had that I referred to Dr. Chair for a consultation. This was his second cancer. So he was totally relieved when Dr. Chair said he had the option of active surveillance. I was in the room. He didn't have an advocate, and he asked if I would sit in and listen with him with a second set of ears. However, for many men in our men's group, it comes up a lot. For a lot of people, because every cancer is different, a lot of times we want to get rid of it, get it out, treat it, radiate it. We want to do something. We want to fix it. It's a very common thing. And yet, it can impact our life in a lot of different ways, and that may not be the best option for us. So we talk a lot about that in the group. How do you live with the cloud that is not going to go away? You have a diagnosis, and how do you keep it back here, not here? And how do you learn to live with that uncertainty and not knowing of if you'll have to have treatment, what might happen down the road? I think for the men that learn to live with that, it can help them in many aspects of their lives to learn, because life is uncertain. We want to think we want to think that we have a plan, and then cancer comes in and disrupts that plan. Life is not quite so simple. So the men that do learn to live with it begin to get really comfortable with it. So I think talking with a counselor or talking in a men's group to other men who've chosen different options, listening to what other men's experiences are might be very helpful.